Good afternoon. This is Dr. Bhupesh from Dr. BKM Institutes, and today we will execute the role play of doctors as well. We have just finished with the role play of nurses, so this is for the doctor. So, you're speaking to the parent of a 5-year-old girl, Linda, who presents with a barking cough, sneeze, and fever. Yesterday, you diagnosed mild croup and recommended symptomatic relief, but that the parent seeks medical attention should symptoms worsen. तो यहाँ पे should का मतलब है if symptoms worsen. तो basically you recommended symptom relief, but लेकिन अगर आप ठीक नहीं हुए, आपकी बेटी improve नहीं होते, then you bring your daughter tomorrow. So the parent has come to see you again today and is very worried that Linda's symptoms condition is getting worse. So being a doctor, अब आपको उनको समझाना है. So you will ask about the symptoms. So father will tell barking cough, sneeze and fever are still there. Doctors rather it is getting worse. So you will suggest the steroid treatment. Explain the possible side effects of the steroid treatment, that suppression of this and this can be there, but you have to be careful how to say that. I will teach you कि आपको side effects के बारे में कैसे बताना होता है. Reassure the patient that steroids are the best treatment for the mild croup. Antibiotic will not work. Offer to review Linda's case in 24 hours. And this again is prepared by Cambridge Box Hill. So again, thankful to that organization. So let me tell you now. So good afternoon. This is Dr. Bhupesh once again. So yesterday I saw your daughter and she was diagnosed with mild croup and I recommended symptom relief. So how is she feeling now? Well, doctor, I have presented again. So obviously, I'm here for my daughter and she's not feeling good. Could you please tell me what kind of symptoms is she having at the moment? Well, doctors, the symptoms are same, cough, sneeze and fever. Rather, they have got worse. Okay. So as I told you yesterday, that if the symptoms will not be relieved, then in that case, we need to give an alternative treatment, which is known as steroid treatment. We rarely use this treatment, but in case of your daughter, as she is having mild croup, so this is the best treatment which is available if the symptoms are not subsiding by themselves. So what steroid does is basically it suppresses the immune system and hence symptoms are relieved. So I would also like to tell you there are kind of possible side effects that may happen with this steroid treatment. There can be suppression of the immune system, as I have already told you. So that means that your daughter might be vulnerable to infections for those particular days she would be on the steroid treatment. But doctor, if you think that she would be vulnerable to infection, she's already infected, why are you giving these medications when these are unsafe? See, as I have already told you that yesterday I tried to prevent these medications, but looking at the symptoms, as you are saying that her condition is getting worse, so steroid is the best treatment available at the moment. For the infections to be avoided, we can tell your daughter not to step out of the house for few days. Basically, she will not go to the school unless her symptoms are relieved. And also you should also avoid going out so that infection can be prevented. So this point would be given if in that case would be required. But doctor, why can't we use the antibiotic? See, I would like to tell you that antibiotics are basically for the bacterial infections. In your daughter's case, the croup majorly there is croup which majorly happens due to the viral infections. So antibiotics are not enough or adequate to eliminate the viral infections. So it will not work at all. So please understand that in your daughter's case, it is very important to give her steroid treatment. This is the best treatment for her looking at her current symptoms. Okay, doctor, then you are the expert if you are saying so. Don't worry. I reassure you there is nothing to worry. We just need to take some precautions. Also, I will keep the steroid doses very low so that it does not affect the immune system in a bad way. At the same time, we will monitor your daughter at regular intervals. Like I would like to review your daughter after 24 hours. Is that okay? Okay, that's fine, doctor. Okay, and I reassure you there is nothing to worry. Your daughter will feel better within 24 hours of taking these steroids, and we will regularly monitor her. So please don't worry. Okay, doctor. So that is how you execute the role plays, even in the case of doctors. So it's just kind of similar in nurses and doctors. In doctors, we have more right to say that, you know, I am giving you this medication. So in cases of nurses, you will say, I am not the authorized person to give the medication, so only doctor will give the diagnosis, doctor will tell the diagnosis, doctor will give the medications. So that is the only difference as per your job responsibilities. But at last, it is a test of English related to your occupation, so English matters the most. This is Dr. Bhupesh from Dr. BKM Institutes. Our contact number is 76967 34256. Thank you.